The Situation Room in its final hour on this day, which is the second Thursday in June, where the budget is being read this afternoon. And this forms the basis for conversations that we have today. The Situation Room, where we talk about a lot of these issues, and we're then going to go into the agriculture and health sector, and we're looking at the budget 2025 and what this all has in store. We'll talk to two of our guests who are here. John Kamau is the forensics lead with for Eastern Africa at PwC, and he's here this morning, and we're going to be giving some insights around agriculture and what the budget says. Good morning to you, John.
Morning.
Karibu sana.
Asante.
Good to have you here. And then also we're going to be looking into the health sector. It's taken a number of hits through the year, and as we get into the year 2025, 2026, the questions surround then will we see a buffering for health. Surprise, yet another Dennis is here with us this morning. Dr. Dennis Miskela is the Deputy Secretary General of the KMPDU, and he joins us as well this hour. Good morning, Dr. Ari.
Good morning.
You well?
Only smart people grace the Situation Room.
I'm telling you.
Yes. Yes.
And if you were three, I don't even know what I've done, but okay.
Dennis the Menace.
It would have been D-O, D-A, D-M.
D-O, D-A, D-M. That's what it would have been at this point. We didn't plan it, I promise. So, look, we're getting into conversations around the budget, of course, but let's just, I want to hear interpretation about certain things, as we do. John, we will welcome you and we want to hear interpretation on today's proverb. We're in Uganda this week. Every week we go to a different African country, and we glean proverbs that, the Wahenga of those areas usually live by, and we want to hear your interpretation of this proverb today. And here it is. When we talk about the hen who stays in the house,
yes,
will never get food. Shall I say that again?
No, I think I got
the
it.
hen that stays at home, rather, does not find food.
You'll never get food. No, I suppose it's similar to the one that says those that don't travel. If you never travel, you think your mom is the best cook.
Something like that.
Yeah, so I would interpret it in terms of, you need to go out there, know what's happening and make a living. Otherwise, if you stay at home, you'll die of hunger.
Okay. Dr. Miskela?
Yes. I think it just means that in everything you have to really go out there and look for it. A rolling stone gathers no moss.
Exactly. You have to keep it moving. That is for sure. All right. So through the year, we've been looking at many things. We've got, and I often say that one of the sectors that we're talking about this morning, both of these sectors that we're talking about this morning, one of them being agriculture. Agriculture takes on this huge responsibility as being the number one marker for the driver of the economy, and has been said that it's the donkey of the economy, because we take everything and we put it on its shoulders. But then the question is, are we feeding it? Are we feeding the sector and giving it what it needs to then be able to deliver this position that garners? So we'll be going into some of that this morning, looking at the numbers already that have been crunched. And then also when we look at health, again, one of the things that you must do to ensure, because who are you governing if you have a sick society? Who are you governing if some of these policies that you put in place then don't go towards essentially healing the nation, right? So let's take an overview, and we start with agriculture, and of course coming in and saying how we're plugging in. Is it something to look forward to when we talk about this one sector that holds this huge responsibility, and the budget numbers that will be read this afternoon? Are we then buffering this sector and this industry in the way in which Kenya ought to?
Unfortunately not. Okay. And this is not unique to Kenya. It's actually an Africa-wide problem. And it's a massive problem if you think about Africa, our population currently, and where we are likely to be in the next few years. So Kenya, for instance, we have a population of 53 million. We'll get to about 92 million by 2050. That's an addition of 40 million people. Currently, about a third of Kenyans are food insecure. So we already have a problem. The challenge is that the funding typically that goes to agriculture every year is in the region of 2%, at best 3%. Similarly, this time around. So you'd have an odd 80-something billion from the national government. The county governments will typically give 5 to 6% of their budgets to agriculture. So if you take the 400 going to county governments, 5% will be about 20. So you have about 100 billion going into agriculture out of a budget of 4 trillion. So that's 2.5%. In the last more than 20 years, Africa has made various declarations, starting with Maputo, I think around 2003, Malabo 10 years later, Kampala last year. And in all those declarations, the target is to get to 10% funding to agriculture. So ideally, we should be speaking about 400 billion. So we are barely giving a quarter of what agriculture deserves. If you then consider that agriculture makes up almost a third of our GDP, employs 70% of the rural population, then it's clearly underfunded.
Okay. That's for an overview. We'll come into and look into the nitty-gritty of it, because then, okay, are we seeing the same thing replicated across the health sector, Dr. Miskela? Because we've been through year upon year of CBAs not met. We are right now dealing with an issue whereby UHC workers are on strike. We are also saying clinical officers, nurses, medical doctors also at the same point saying, you know what, if you don't do what you're supposed to do, then we get to a place where we're not able to activate. This all is around budgets. This is all around money spent. Do we see that coming into the year? Health, again, if we just look at that 15%, the 15% is a number that Kenya has not been able to reach in a while, and we're going to see those numbers read this afternoon. Do you expect that we'll see an increase?
Thank you very much. First of all, I have to really feel sorry in some sort with the government, because we are asking of so much in a very, very shrinking tax collection, because the citizens are very keen that they don't want any more taxations, and their debt should be paid. So whatever is left of to sort out some of these things may not be adequate, but nonetheless we expect certain things to happen. That said, I have to say that I'm really disappointed with the budget estimates that I've been able to look at, especially in healthcare. As healthcare workers, we've been very happy that health has been a critical agenda for this government, and I think there's no single political or meeting where the president and his team doesn't talk about UHC, the Taifa Care and all that. But now the part for walking the talk is where the challenge is. And I have to give an example. If you look at the sector allocations, health comes at a distant sixth, long after education has gotten there 630 billion, long after energy, ICT infrastructure, long after public administration and the defense force and all that. So then the question begs in that, where do we lay our emphasis? Because more than ever, COVID taught us that health is everything. Even if you give 630 billion to education and there's 6 teachers, they won't be coming. The teachers have complained about their medical covers. They have a very pathetic cover, and you're not working towards sorting out that. Those 6 children won't go to school. The 6 policemen won't go anywhere. In the long run, you end up with a dead professor, because you have a failing healthcare system. And that's why we must walk the talk. We talk about the funding of healthcare. There's nothing like free healthcare. We keep on telling people about UHC, free blah. There's nothing like free healthcare. Healthcare must be funded by somebody. And with a 31 billion gap from the USAID pullout, then you wonder why you only increased healthcare budget by a measly 1 billion. And look at, for example, the SHA. I keep on saying that had 3 funds. Only one is the contributory scheme, the shift part of it. The other 2 schemes, the private healthcare fund and the emergency fund, they are exchequer funds that should be allocated money. But look at what the SHA asked for 61 billion for the primary healthcare fund. They got 13 billion. They asked for almost 144 billion for the emergency chronic and critical illness fund. They only got a measly 10 billion. So this means that Kenyans will still have to dig deeper in their pockets to be able to access quality and affordable healthcare in this country.
Should we be looking at a budget, essentially, that takes care of all of these needs Isn't that what you would imagine, that this is the money that you have and that you want to split it across sectors, John, and then you say, well, based on that, this is what the need is. We're then going to allocate fund according to that need. That it would appear to me that that's what it should do. Do we then see the counter happening with the budget estimates so far that we've seen?
Okay, thanks. I wouldn't say it's a counter. I don't imagine that anyone in government deliberately wants to not fund agriculture or health. It's a question of we don't have enough funds.
Is it?
One. Two, it's a question of how we use the little funds that we have. And I mean, if you think about it, and I mean, as you introduced me, I'm in forensics, so you might wonder, why am I speaking about agriculture or even health for that matter? But it's because in our conversations and in what we see, there's scope for us, to earn more if, for instance, we plug the leakages in terms of revenue collections, for instance. Two, in terms of the little that we have, we could apply it better, because we are talking about underfunding in the budget, but there's an maybe even greater question. Even those funds that have been allocated and are available, how much of it actually gets to do what it's meant to be doing? And because if that was happening, if all the money that is meant for agriculture, for instance, all the money that is meant for governance is used and used effectively, we would then generate more as a country. So, for instance, as agriculture, if it accounts for 33% of our GDP, if we were to double the output from agriculture, it means our revenues could double almost. And then also, you have an entire value chain that depends on agriculture. If you're producing more, you will have people buying more inputs. You will have more manufacturing companies that rely on agriculture. So if you sort the problem and you have the right amount of resources being used effectively, then you get to grow the pot. So then there's more money available from government to allocate to not just agriculture and healthcare, but across. But the other thing is, especially in agriculture, but also in healthcare, government acts more as a catalyst. We don't expect government to fund agriculture in its entirety. A lot of agriculture funding comes from private sectors. You and me, who are what are we, online farmers, everybody that puts in some money into their shamba, the agro-processors, if you are Mumia's Sugar, for instance, you are funding contracted farmers, lenders, banks. So if the right infrastructure is there, the government funding will only be a catalyst, and then you'll get funding from the private sector especially, but also donor funding and all. So we need to get more money so that everybody then can get what they need, and then everything then works because you have more and then more to share.
You've talked about amounts and resources being used effectively. My question is, looking at the current budget and previous budgets, fraud and wastage always continue plaguing key sectors when it comes to budgetary allocations and provisions.
Yeah.
What, in your opinion, do you think are areas that are leaks that we need to sort of seal? Because you have different allocations, but then because of the wastage, you end up having a lot of leaks here and there. What, in your opinion, do you think are the leaks, and how do we seal them?
And that's $1 million question. And unfortunately, it's almost easier to ask, where do we not have leakages? Because I feel we have a cultural problem. And this is not just in the public sector, because a lot of time when we speak about corruption and leakages, people think of government and the public sector. But if you consider, for instance, what happened, say, with Equity Bank the other day, and listening to their group CEO around the number of people implicated in whatever process that they're undertaking, and some of the other things we hear even from the private sector, you start to get and we do a lot of work in forensics, so we have a good sense. So there's a lot of leakage both in the private and in the public sector. And it's a cultural issue. It's a question of values. It's a question of ethics. And I think we all know that that's a challenge, and we need to start working on it. But also another fundamental question is we never really measure how much we lose and where we lose it. So we then keep on putting in money without necessarily knowing where we are leaking this money. There's a story I heard not too long ago. I think it was from an Indian, someone from India, who was giving an analogy and comparing a farmer in India and a farmer, I think, in Denmark at the time. And they were saying, I don't know how true it is, that in Denmark, if you are a farmer, a dairy farmer, you go, you milk your cows, you put your milk in a dispenser somewhere. A customer who wants the milk will come, dispense the right amount of milk that they need, leave the money that is commensurate with whatever milk they've taken. So the only cost you incur as the farmer in selling that milk is just putting the milk in the dispenser. So the customer then actually only pays for the milk. Now, in the example they were giving, I believe it was India, it could be a different country, and you can use it in Kenya. Because you can't trust that your customer will come and just dispense the right amount of milk, then you have to employ a guard to check, to make sure that nobody is taking more than they are paying for. Then you need to employ an accountant to count the money. You need to get an auditor. You need to get a fence. So ultimately, when the customer pays for the milk, they pay for much more than just the milk. So if you are to ask what is the cost, what is the value of corruption in that case, or lack of ethics, it's a lot, which we never really get to measure. So there are those obvious leakages where money just doesn't go where it's meant to. But then there are all these other things that for instance, increase administrative costs. And you will see a lot of budget allocations, for instance, go to administration. Whereas in an ideal situation, they should actually go to dealing with the real issue.
Dennis, I have a question for you. Yesterday we had MP Githunguri here breaking down the finance bill, and we were looking at the whole idea of what is hidden in this year's budget in the name of, fine, we're not slapping taxes on you, so that's what Kenyans want to hear, no more taxes. But there are a lot of things that are hidden behind what has been proposed. What, if you look at taxation on essential health items, you look at proposed VAT changes that affect the cost of critical health supplies and medicine, for example. What do you see happening in terms of the effect on patient care and hospital operations, and also looking at the affordability of medicine for the Mama Mboga, the Otieno, the Wanjiko, the Nyambura, the Okari?
Yeah, as I keep on saying that somebody must pay for healthcare, and healthcare you can either fund it from people's pockets, where the poor have to sell their cattle and land to afford healthcare, or you can do it through insurance, whether it's a social insurance scheme or a private insurance scheme, or through donor funding and grants, or through taxes. I think the biggest challenge that we're having in financing our healthcare is that we, as government people, we have refused to accept that health is a social responsibility of any nation. Just the way you plan for education and the security, you should plan for healthcare. You don't hear them saying that we're going to have a mchango for education or a mchango for hiring police. They are allocated from the taxes. And we have always repeated that the funding of healthcare must be tax-based. In a country where 80% of people are informally employed, you cannot then come tell us that a social scheme, which you cannot enforce the Juakali people to pay, is how you want to fund your healthcare. So then you ask yourself that, then why is healthcare so expensive? They'll always tell you that it is expensive because you have to pay doctors so much, the current expenditure. But the truth of the matter is that we have done a research and we found that the biggest driver of healthcare cost is the price of drugs and equipment and the technology. And why is the price up? Because of the taxes. Yeah, it makes no sense to increase taxes on things like essential drugs or on medical equipment. Yeah, some of the people who went to set up hospitals, they tell you that the biggest struggle they have is around taxations of those. So do you waive or just remove some of those taxes to bring the cost of healthcare down? The thing I tried to say is that all is not lost in the current budget on some of the issues, because under UHC and the pillars of UHC, after you have built the hospital and equipped it and brought drugs, I see they allocated money for cancer. We are, as a country, we have met the requirement of facilities per population ratio, because within 5 kilometers you can get a health facility.
Yes.
Yeah. We are doing these funding reforms around SHA and the digital health. The part that has always struggled for the longest of times is the human resources. You see the strikes and the upheavals all over the place. And this is because two things. One is that we still approach healthcare from the recurrent expenditure side of things, that you'll tell the county that don't go beyond 35% of your budget on recurrent expenditure. But if you look at it, healthcare is an investment. Yeah, because all these are people who are out there doing these things must first of all be healthy before they do that. So if we just consider health as an investment, then we'll be able to remove and that it's from that whole Public Finance Act which talks about the 35% ceiling. That's one. Two is that in this budget you can see that they have allocated money for the interns. You know that the internship issue was a very big thing for us, and their salaries and the money have been allocated for them to be paid as per the agreement. The UHC people have been out here for months on end about fighting for their absorption to permanent and pensionable, and they've allocated money for that. So that will go a long way to sort this. They've allocated money for hiring healthcare workers, which is a good thing. With the KMPD talked about the areas that were owed to them for the last 7 years. They've allocated money. So I know for sure that if we are able to then also challenge the county, there's something good that's happened in this country that people don't talk about, that the Facility Improvement Fund Act that says that money collected in a facility must remain in the facility. Yeah, there's no way you're going to tell me that there are no drugs when a drug was brought. If the drug ran out, means that somebody paid for it. So right now, most counties are able to collect within themselves. Instead of the money being collected in the facility and given to the government to take to MCAs to Zanzibar, that money is right now retained in that facility to buy the drugs, to buy the food, to hire more workers, to clean the hospitals. So that's a good thing. That in facility source of revenue is a very, very big thing. But my challenge to the government that healthcare is almost 95% involved. Why are we still having billions stuck in Nairobi? Yeah. Why are we still having 137 billion plus? I was talking to my friend John and he was saying that is almost 200 billion stuck in Nairobi. Why can't we let the function and funds to flow?
When we look at these numbers, just from what you're saying now, these issues essentially is what should form the decisions when by the number crunching starts in September for any budget process. Right, end of August going into September, that these things that we see playing out, we know, for example, you have a footprint, for example, of where in the country people get sick with certain issues. We know that. We know what medical equipment is needed. We know what research is needed for these things to happen. People do this work every day. You know, for example, in the agriculture sector, that this is what happens. This is what is needed. If you look into the region, who is doing better when it comes to farm inputs? That you've removed import duty on agricultural products that are coming in from Uganda and Tanzania, but then you've increased the duty on farm inputs for Kenya, for farmers in Kenya. So what forms the decisions as to then where you will put the money if you can see the realities on the ground? Dr. Miskela and folks who are every day telling us about this is what we actually need to look to. If we talk about preventative care, for example, it should then form the basis of how we spend money in the future. Do we see a symbiotic relationship between the information we have? We don't have to look for it. It's right there. And then the decisions that are being made as to where the money will come from. Do you see that manifestation? Yes,
and I think the government clearly also sees it and is moving in the right direction. So, for instance, we are moving towards zero-based budgeting as opposed to incremental budgeting, where incrementally you just say last year we allocated X to agriculture, therefore we'll do X plus 5%. So we are moving to zero-based budgeting, where ideally, in the ideal situation, you should then go and ask yourself, you have zero money. What do you need to do, and how much does that cost you? And then we're also moving towards a hard ceiling sector budget, where we say for agriculture, you can only spend up to X, or for defense. So in an ideal situation, or once this is implemented properly, then we should get to a point where the budget is actually reflective of the needs and the actual costs on the ground. I guess because it's still early days, we are probably still learning. Hopefully, we get to implement it and get to that point where we are actually getting it right. And unfortunately, I think our issue is usually not in policy making or in coming up with the laws. it's in the effectiveness of implementation. So hopefully then we get it right, but we are moving in the right direction.
Okay, we're asking ourselves questions, of course, around budget and what would be necessary. Do we see that even as those numbers are read, that we will see an exact representation of the need? Because the situation, Dr. Meskela, when we see that strikes have been happening year on year, complaints have been made county to county, research questions about health have come into place, treaties or pacts that have been ratified by Kenya have been put into place. But do we see that maybe we're getting to a place where, John is a little bit optimistic that we will actually now start to see those agitations come to fruition?
I believe that the better days ahead, especially now, like in healthcare, we have the Digital Health Agency and the Digital Superhighway, where we are going for the first time to be able to collect real-time data. We have really struggled with getting data in healthcare and having that data to inform decision making. The world right now is a world where decision is backed up by facts, and being able to understand. For example, it sometimes is heartbreaking when you hear that the expiring drugs in KMS or in facilities means that somebody must have overprocured or procured the wrong things. Why do you take malaria drugs in their thousands to Embu when you know that Kisumu people probably need it more?
Yeah,
you get that. So what Digital Health Agency and the Superhighway is doing, that we are going to be able to back up with facts when we tell KEMSA procure this more, buy this less, when we justify why we need to hire more healthcare workers and for what. Because I happen to have sat in the Presidential Task Force for Healthcare Reforms, and even just getting data of healthcare workers in this country was not possible. This issue around internship was simply because somebody did not know the numbers that are going to be coming out last year. So they found themselves having budgeted less. So working on that it will go a long way in improving the situation. The other thing that makes me happy is that Kenyans every day are getting to know what their rights are. No, they are no longer sitting back and think that is some sort of benevolence that a politician will build a road or build a hospital. People are now asking tough questions on what the money is doing. And now people are questioning, when you allocate 2 billion or 400 million to fixing the same public office every year. People are asking those questions when you allocate money to doing things that don't bring changes to people's lives.
Yep.
And it's a good thing. And we have to appreciate that we have that space that people are able to ask those questions. The fact that the government right now, after last year's occurrences, are able to listen more and tell people that no, we are willing to listen to you on some of these issues. I think it goes a long way. The only thing that I'd like to ask the citizens, that beyond expressing that power, then don't just question, then keep quiet. Question and do something about it. But more important, that read and understand it, because sometimes I don't think that people don't read a lot. People don't check some of these things, and then they are also carried away with rumors. Yeah, majority of Kenyans right now can read and write, and we should be able to participate fully. Because what I also find very disturbing, that lately Kenyans have become very, they have resigned to fate when it comes to matters of public participation. Because some of these budget policy statements are out there. People are invited to come to social halls to give their opinions around them, but they are not able to. And finally, that finish, the leadership of this country must know that they're now dealing with a different set of citizenry. People who know what is supposed to be done, and with social media they're able to bounce these ideas. So this idea that leaders think that they're somewhere, then they want to talk down on people, telling them that no, we are going to have, like for example, the housing levy. You're going to have a housing levy, then today they are building houses, tomorrow it's building a police station or a bridge. Such things, Kenyans don't mind giving out to support the government activities, but don't keep on giving these convoluted stories. Today it is this, tomorrow is that. It is forever changing faster than a chameleon's colors. Yeah, tell us clearly that this is what we are going to, and we push it to the end. When you have achieved enough money to build those houses, then give us back our money, because as workers we are really struggling with our shrinking pay slips. The unions have been so nice, this government, that we have not even asked for pay increase because we know where this country was coming from. But if I'm not going to ask you for more salaries, then please don't touch the little I'm receiving. Because right now, more and more, if you look at the housing levy deductions, then look at the share deductions, then you add to these other forms of taxations, people are left with so little that you're not able to get by. You're not even able to invest on anything. You're not even able to expand the economy in your own little way because they're taking so much from you. Then, now, if you took 2.5% of my salary for healthcare, then I should not have to buy drugs again or have to pay again for healthcare. But this idea that you're taking almost like for doctors beyond the 7,000 per month on share, you've also lost 6,000 on medical allowance. So that 13,000 shillings every month you're giving to this government for healthcare. Yet when you fall sick, you still be told this drug is not there. So so they must be able to, once we surrender our monies to them, they have to then in return show us value for it.
For service.
If we are giving you money for education, it is wrong that I still have to look for an academy for my child because the public health system is crumbling. If I've given you money for boreholes and dams and all that, I should not be still buying water in bottles and dispensers. Get that? You must then do your part. If you're going to give so much to transport ministry, I should not be taking loans to buy cars. There should be public transport in this country. This idea that citizens must resort to private intervention because public interventions are not working. Why do you have to hire private guards and all these private companies when you are paying for the budget for the security in their billions of shillings? That's what we talked about. You end up spending more in doing something that your taxes should have been doing for you. We don't mind giving 50% to government, but once I give the 50%, then the other 50% should be strictly
For you.
For me and my family on food and maybe a holiday here and there in Mombasa. Yeah.
Why don't we see the requisite action in terms of where, because essentially when we look into budget, we look at the finance bill, which essentially becomes the finance act, is that we know where there will be movement, very plainly put, where there will be increased or standardized taxation, which is essentially taking money from people to run certain government activities. But if we don't see those activities, if we did an audit of the budget from 2024-2025, what we were told, because all of this is in public record, what we were told was going to be what that money was going to be used for. The Auditor General has already told us in an interim report that we don't see full absorption of funds for what they were supposed to be used for from budget 2024 to 2025, and we are in another budget cycle today. So those issues where we see the proliferation of private sector engagement should not be the case when there is taxation that is meant to fuel public sector activities. But that is exactly what we are seeing happening. So why should you have to pay more for certain things to be done when you've already given your hard-earned money to ensure that it's done at the public sector? We shouldn't see that. You shouldn't have to spend more for security. You shouldn't have to spend more for water. You shouldn't have to spend more for healthcare. You shouldn't have to spend extra outside for education. You shouldn't. You shouldn't, as a farmer, have to spend more for farm inputs when your taxes have gone to make sure that you can. Mind you, there's VAT on a lot of those. Like you say, it's been excise exempt on this side, but it's been VAT taxable on this other side. The money is being spent, but you cannot see the requisite action or engagement after that. And then we see the proliferation of private sector activity. Why?
Good question. And the question is, why do we have missing outrage? You would expect people then to be outraged when things that are promised don't happen. And I think Daktari has put it well. One has been a question of information. So if you don't know what you deserved to get, then you can't be outraged because you don't know what you lost. I think the second issue has been an issue of courage to call out things. So as I mentioned, for instance, we are seeing people even in the private sector, banks, calling out the issue, first internally, and then, it's not unique to any one institution. It's a cultural issue. So when you have people beginning to own the problem and call it out, I think we'll be moving in the right direction. I think also because of many years of, treating the government, the Dr. was saying, as bwana mkubwa, you don't question, you just do what you are told. I think people then have lost their sense of agency. So you'll, for instance, hear people complaining about government issued fertilizers being sold in a local shop. And when you think about it, who are you complaining to? Because you really don't expect the Minister of Agriculture to know that fertilizer is being sold sold in your local shop. If you never report that anywhere, then nothing will get done. And then you get to that level of sort of everybody has given up, there's complacency, and we just accept it. So the whole issue of social accountability, people knowing that at that social level, at the point at which I am supposed to be consuming or receiving these service or good, that is actually where the accountability should happen. And government has made the right steps, at least from a policy level, in terms of, for instance, availing public information. For instance, we have a database or a site where all public procurement or tenders are supposed to be published. If you go there, you will find some have been published, not all have been published. But if you are to push for all of them to be published, then you start to get the kind of data that you require. Now, once you have that data and you have a sense of agency, so you own the problem and you want to do something about it, then we move to the question of what can you do about it. So there are things like reporting, for instance. The Witness Protection Act has been enhanced. So again, ideally, well implemented, it should be easier and safer for people to whistleblow and report on these things. We have social media, we have, media. So a lot of this information, then once people have it, they should then communicate it. And then we would expect, for instance, that the various government agencies, EACC, DCI, will then take action. And again, we've also seen enhancement of the laws that should allow them to do that in terms of the Criminal Procedures Act and the likes, or suggestions made by EACC on, for instance, strengthening the Anti-Corruption and Economic Crimes Act. So we have the infrastructure. I feel we now have the data, and it's a good thing that data is being used. So, for instance, now farmers have been registered by government. Government is using e-vouchers to issue out fertilizers, for instance, subsidized fertilizers. So we should have the data ideally to then now go and review and assess how much of it actually got to people. Are these people that we know, and especially at the local level? So I think we have everything that we need. Probably now it's a shift in mindset. So as opposed to waiting to serikali's idea, we to this idea, but we also then hold serikali accountable.
John, speaking of data, do you, through your forensic lens, do you think in the budget making process there's an adoption of forensic audit recommendations from past budgets, or are these just shelved? Do we sit down, start making a budget, but in reference to last year? Let's look at the numbers. Let's look at that data. Do we even do that?
So historically, we haven't, because, as I said, it has been incremental. So we gave health 100 billion. Now let's give them 110. But in a zero-based budget, you should ideally then go and ask yourself, how much did we allocate last? Actually, that shouldn't even be the main issue. It should be what needs to be done and how much does it cost, and then what funds are available, and then allocate those funds, in line with the need. But then also go back and check whether it's a forensic audit or the normal audits that the Auditor General does every year. Ask, for instance, even a question of capacity to absorb. Because in as much as we are saying there is not enough money, you also then get situations where government agencies or departments are unable to use what has been allocated.
Sure.
So, what would be the point of then allocating more if you can't even use what had been allocated previously? So that hasn't traditionally happened, but then ideally now should happen with a zero-based budgeting, and also even in terms of the reporting, we are moving from a cash-based accounting where you account for the cash you used to an accrual accounting where you account for what you committed to. So, for instance, if you launch a road that will cost $1 billion, but only spend or report 100 million, the reality is that you've committed government to $1 billion. So if you're just reporting on the 100 that you used, people will then not know that you've actually committed $1 billion. And that's then how you end up with pending bills in the hundreds of billions. So there's a lot of data. There's scope to use that data better. I think we're in the right direction, but we need to do more, and we need to hold those people responsible, accountable in terms of what they come up with.
And I think that was a question that we started off with, and we've come full circle here, that to say that, do we actually see that there is a direct use of information and data that has been collected that will fuel decisions that you will make with money later? We have too many examples, kind of like what Dr. Miskela was talking about earlier, is that we know, for example, that the reforms towards healthcare have been trying to go into a preventative manner.
Literally, whatever you're taking good money and putting on bad use, then you want Kenyans to believe that we are doing the right thing. So look at when we banned over 400 billion building the SGR, that ended up in the middle of nowhere. Yeah. So this budgeted corruption, I think, is what is really, really messing up our country. And those who are paying for it the most, sadly, are those who are on the fringes of the society, the poor, the marginalized, those who have to sell literally their last human possession to be able to access. When you live in a country where for your child to get a semblance of education, a poor child has to get some sort of education, then the community has to really sell everything for that child to go to school. Yeah. So this circle of poverty then continues because you had poor parents who go take you to school, then you can't access contraception, you get pregnant, then you remain up in the poverty, your children. So breaking that circle of poverty, then you have these extremely detached, extremely rich folks on the other end who are benefiting from your pain. Yeah. So that I know the saddest thing, and I was telling a friend of mine that back in the day, when you wanted a cheaper unga, you'd go probably to Kibera, or cheaper tomatoes, you'd go to Gikomba. Right now, the price of tomatoes in Gikomba is the same price in Lavington. The same unga packet is the same across. Right. So imagine somebody adding 10,000 shillings on a salary when somebody else is paying that one for a single meal of the day.
Yes.
And you live in the same country. Indeed. And nobody feels their pain, nobody sees them. And we for the first time as a country, we must sit back and think about being each other's keepers. And the budget that is being read today must speak. That's why sometimes people get offended that I support this idea about us people are working, contributing to build houses for the poor. But I'm like, that's the least you can do. This country, 50% of what we collect goes to pay civil servants. What about yet people are all giving taxes?
Indeed. So
we must be able to think about those who don't have enough. And this budget, I hope that CPM body will be speaking to the needs. They say that bottom up, they keep on talking about.
Yes.
We want to see this budget speak for them. Yes.
Indeed. And this is why we have these conversations, because people have to be engaged. We have to be informed. We have to talk about them and let them know that we know as well, so that we can make these informed decisions going forward. Want to thank both of you for being here this morning. John Kamau, Forensics Lead, Eastern Africa PwC, and Dr. Dennis Miskela. Thanks for making it the third Dennis this morning. Deputy Secretary General of the KMPDU, Asante Sana, for being here. Let's see what happens this afternoon from 2. Looking forward to a better year, essentially. Good morning, everybody.
This is The Situation Room, the only way to start your day.